here. Thank you to the organizers. I'm going to talk as fast as I can, but hopefully still be comprehensible. So my name is Dr. Nadia Hashimi. I'm a pediatrician. I'm a small business owner. I'm a novelist. I'm a board member on a nonprofit, and maybe most importantly, I'm a mom to 4 kids who do a really good job of holding me accountable. So I'm used to that part of this process already. You know, I'm running because I have spent the last decade working as both a pediatrician and as a novelist, engaging with people, hearing their stories, listening to the issues that are keeping them up at night. And so those are the people that I'm running on behalf of. It's because I want to fight for them. So when I talk about those people, I'm talking about a mom who's really worried about whether lifetime caps or pre-existing conditions are going to be an issue again because her little girl has been diagnosed with diabetes. I'm running because of the vet whose care has been delayed to the point where he's almost near paralysis. For the woman who is battling on one end paying for college tuition and on the other end dealing with the burden of caring for elderly parents. And for one of my volunteers who came to me because she felt empowered by the conversation we had around her 4-year-old child with autism. And she pays hundreds of dollars each week to pay for the specialized therapies, but those therapies work. And she's gotten the victory of having at least one opportunity to see him recently walk across the playground and say hi to another child for the first time. So it's for those stories that I think we need to advocate, and that's what I'm doing. I am not a politician. Yes.
Is this better?
Yes.
Okay. I'm not a politician, but I'm trying to coin a new phrase here. I'm a pediatrician on a mission. My story in brief, my parents came over to the country in the 1970s from Afghanistan. I was born in New York and raised in the New York, New Jersey area. I grew up in a small town in New York and upstate with apple orchards and dairy farms and snow up to our knees. My parents had a deli there, and I grew up from the age of 12 working in that deli, getting up at the crack of dawn and making coffee for everyone in town. My parents taught me a lot about hard work and not taking anything for granted, and that's an experience that I really think has been grounding and giving me a foundation for life as well. And from there I went to Brandeis University. I worked on a nonprofit for a bit. I worked for a year at Memorial Sloan Kettering in the Human Resources Department. I went to medical school in Brooklyn. I then did my pediatrics training at NYU and Bellevue hospitals in New York City, seeing a diversity of patients all across the socioeconomic borders. In 2008, I moved to Maryland, and I started working at DC Children's Hospital in the emergency room there. And again, seeing a lot of different patients, a lot of different people. My writing that I started in 2009 has taken me into libraries, living rooms, classrooms, college campuses to talk about the intersection between issues like poverty, lack of education, women's rights, reproductive rights, drug addiction, and human stories. And to me, that's what politics is. It's that intersection of issues and what are we going to do about it? What does it have? What kind of impact does it have on our human lives? Doctors live by the oath of do no harm, and I think in politics we should be doing the same, and I don't see that happening. When we have gun violence and a lack of research about how to handle it, we're doing a whole lot of harm, and actually it's straight up killing us that we're not tackling that head on. And as a pediatrician, that's something I care about a lot. As a female physician, I'm worried that we have a whole Congress making decisions and not a single female physician in there doing that, being part of that. And I think we need to be part of the conversation. This is our democracy. It is we the people who are now standing up. It is our voice that's going to be the voice of change. I hope that I can win your support.
Hi, my name's Andrew Duck. Can everybody hear me? Yeah. Okay. My name's Andrew Duck. I am running for Congress. I am not a traditional politician. I have never held office before. I have run for office before, and the only office I've ever run for is the 6th Congressional District. And I'll tell you a little bit about that as I tell you about myself. I'm from Maryland. I'm the 15th out of 17 children. I graduated from Middletown High School in Frederick County. After I graduated, I met the woman who I'm now married to, who graduated from Seneca Valley High School in Montgomery County, and we had a child. My son was born premature. He weighed 3 pounds, 10 ounces. I could hold him in my hand like this. And what I had to do to get health care for that pre-existing condition is I joined the Army. I don't think anyone should have to put their life on the line to get health care for their sick child. So you can follow along. You'll see the top thing I have here on issues is the fact that I support Medicare for all. And that's an actual House bill that's been submitted. I joined the Army. I started as a company clerk. I became a Korean linguist, and did signals intelligence. And I then went to officer candidate school, became a military intelligence officer. I deployed 3 times to Bosnia, where I think we showed exactly how American military power could be used to bring peace to a troubled land. And I did 1 tour on the ground in Iraq. And that was so frustrating that I came home and submitted my retirement. When I came home, I became politically active, and I started just trying to get rid of George W. Bush. I started a small grassroots organization, Frederick for Caring. That led to people encouraging me to run for Congress. And I ran for the 6th Congressional District when it was the old Congressional District and nobody else cared about it. And we didn't have anybody that didn't live in the district coming up to run. I had to do it, and I did it basically, it started as a Republican advantage of 14 points. I just worked hard on the ground, grassroots organizing, with very little money, but lots of effort from people just like you, doing voter registration. We did so much voter registration, we increased the number of Democrats in the 6th District by 9%. But that's between the nomination in 2006 and when I got nominated in 2010. That cut the margin significantly. The Republicans caught on, they started doing voter registration as well. But we made a 4% shift in that, which was not enough to flip the district, it was enough to get the attention of the people in Annapolis. That's why they redistricted and made this now a Democratic seat. We need to keep it that way. So at the end of 2010, we had a Democratic governor, a Democratic president, and a Democratic congressman. I said that's good. I went and did some green energy research stuff with my spare time instead. But when I woke up after the last election, like many of you here in this room, I was shocked. What I did is say, I need to get active again. It started the Sunday after the election with a Love Trump's Hate rally in Frederick. That grew into an organization called Frederick Cares that is devoted to positive social change on a local level in Frederick County. They've done volunteer fairs, they've done bystander training, a whole host of other things. I've also been active in Our Revolution Western Maryland. I've been active in grassroots organizing across the district because while I'm running for 2018, we cannot wait until 2018. So thank you very much for all of the work that you're doing. Keep it up. We need someone who will do that. I'll talk to you more later, and if you really want more information that we can get in our meet and greet, sign up for a house party. I'll come and I'll answer every question you have as long as you have it.
Thank you, Andrew. Roger Mano?
Good evening. I'm Roger Mano. I'm a state senator right here in Montgomery County. I represent central Montgomery County from Aspen Hill up to Gaithersburg. I've been in the state senate going on 8 years now. I served in the House of Delegates for 4 years before that, and I'm quite an activist when I'm not in the legislature. So I want to thank MoCo Women for the great work that you all do and the great advocacy groups in Montgomery County, which make us really the greatest county in the state. Let me just tell you sort of what's at stake here in my opinion, and I'll have to tell you a little story to get you there. I was born in 1966 in UCLA, California, UCLA Medical Center. My mom was a student. My dad, John Mano, was an artist and a carpenter. We didn't have any money. We were very poor, but we were happy. I was on my mom's back in 1968 in Berkeley. I had my first taste of tear gas, which served me well in politics. We moved to New York City in 1971. And my dad didn't have health insurance, got sick. You've heard this story before. It's not unfamiliar to many people. He died alone because he was poor and didn't have health care. And that economic event thrust my mom and I into kind of an American horror story that's not unfamiliar to many of you, right? Sort of healthcare nightmare in this country. My mom was poor. I lived on the street, was in a group home for a little bit of time, and we, with help of great social programs and some angels, we made it out of that mess. And growing up, I saw other kids who seemed to have wonderful lives and wonderful families, and everything was beautiful, and ours was not. And I wanted to understand how that worked. And when the light bulb went off for me, it was about healthcare. And I wanted to fix that thing. I went to community college several times, graduated from City University in New York with help of many angels. And a judge who was in my life as a young ward of the state said, you should go to law school. And I wanted to fix healthcare, and that's where I went. I got a joint degree in intellectual property law, drug patents, and my Juris Doctor. And I went down to Capitol Hill and worked for three great members of Congress. Jerry Nadler from New York, Sheila Jackson Lee as her senior counsel from Texas, and Sanford Bishop from Georgia. And I learned the ropes of how government ought to work with communities and lifting up broken communities and broken lives. 2006, I had the honor of being elected to the House of Delegates. And shortly thereafter, I got a call from the White House, President Obama's White House, to serve on a working group of health legislators for health reform, and stood a door away from the Oval Office with a group of lawmakers from around the country and inked out provisions of the Patient Protection and Affordable Care Act, right? And we did that. I was elected to the state senate, and I've been there for 2 terms. And I'm running for Congress now because that story, that progress, that all that we did to get to this moment is under assault by government, right? Not some act of God, not some tornado or hurricane coming out of the Caribbean, but by people who work for us, right? And that makes me very angry. And if you give me this opportunity, I promise you this, I will go down to Congress and I will fight like hell that the thing that happened to me and my family, that happened to many of you, doesn't happen again. So thank you.
Thank you, Roger. Aruna Miller.
Good evening, everyone. Again, my name is Aruna Miller, and like all of you here today, I'm a proud Democrat. I've lived in Congressional District 6 for 27 years, as it's currently drawn. So my husband and I raised our 3 daughters here, who all went to public schools. We live in Darnestown, Maryland, along with my mom and 2 very naughty dogs. But anyway, first off, I want to say thank you for all of you for being here. Thank you, MoCo Women, for being such a progressive voice here in Montgomery County. Thank you, Lisa Fuller. Where are you? There you are. Thank you for being the founder of this organization. To all of you who make it so great that we're here today. So I'm an engineer, right? And I'm a civil engineer. So I like to say, as a transportation engineer, I know how to move people, right? Because I'm involved with the planning, design, and construction of our infrastructure in our county. Now, you may wonder, okay, infrastructure, is it really that important? Let me tell you how important it is. The Washington, D.C. metropolitan area is rated, or ranked, number 6 in the nation for the worst traffic congestion. So what does this mean? It affects our quality of life. That means our residents, you and I, are spending 72 hours stuck in gridlock on roadways. It means that our area cannot be globally competitive because we're losing money as a result of our workforce being stuck in the roadway. And I think this is an important lane that we need to bring to U.S. Congress to be able to have a representative that could fight for transportation infrastructure, whether it's just in infrastructure and transportation, or we're doing broadband infrastructure or healthcare infrastructure. This is critical to us moving forward. I'm also a Maryland State delegate, and I thank you for the people that have voted for me and trusted me for voting for me twice to represent you. For the past 7 years, I've been representing the people of District 15, which includes Potomac, Germantown, Clarksburg, Boyds, Poolesville area. And it has been my greatest honor to serve the people here. And as a Maryland State legislator, along with my colleague Senator Mano and many others at the General Assembly, we have fought to work to make Maryland the progressive state it is. We have fought to make sure that working families could have the income that they needed. We raised the minimum age. We made sure that we had paid earned sick leave. Now, the governor's probably going to veto this, but we're going to come back and fight forward and make sure that our employees get the earned sick leave they deserve. Because you know what? The greatest prescription for a healthy economy is a healthy workforce, and that's what we're going to fight for. And we've also passed common sense gun laws in the state of Maryland. We were one of the first states to do so. And these are the type of progressive issues that I'm going to do if elected to Congress to have the honor of representing you. Now, I came to this country when I was 7 years old as an immigrant. I didn't know a word of English when I came here. It was the public schools and the educators who taught me everything that I know today. And I will forever be grateful for that. It's also the taxpayers that invested in me. When my family and my dad particularly hit a health crisis and I was in high school, there was no way I could have afforded to go to college. But it was the taxpayers and the safety net and the policies that allowed me to go to college and get a degree in engineering. It is every individual that I've faced over my lifetime that have showed me and inspired me through their courage, their resilience, and their selfless acts to fight towards something bigger than ourselves. That's why I'm running for Congress, because I benefit for everything that our government policies have given to each of us, and I want to make sure that we can do this forward. And I always believe that democracy can outwork when each of us is more important than all of us. So that's why I'm running for Congress, and I thank you for being here.
I want to thank all of the candidates. I don't know about anybody else, but I feel such a sense of pride in the quality and the caliber of the people who want to represent us. It's amazing. And, you know, when I think about who our leaders are now from the White House through the GOP in Congress and all that they want to take away, and we've just heard 4 people who only want to give and want to help us. And very, very proud to have you here. I want to thank Kevin Mack. I want to point out Kevin Mack. Works for John Delaney. You can thank John for us for representing us so well. And Kevin has been our mentor from the beginning of MoCo Women.
He walked into our first meeting and he had a little badge on. And I literally